USMLE style question on lung airway resistance. Question: a 60-year-old man with a history of chronic obstructive pulmonary disease (COPD) presents to the clinic for a routine follow-up. He reports increasing shortness of breath, especially during physical activity, and a chronic cough with minimal sputum production. His vital signs are blood pressure 130/80 mmHg, heart rate 88 min, respiratory rate 18 min, and oxygen saturation 94% on room air. On physical examination, there is bilateral wheezing on auscultation, and prolonged expiration is noted. Pulmonary function tests show a reduced FEV1-FVC ratio and increased residual volume. Which of the following is the primary factor responsible for the increased airway resistance observed in this patient? A. Bronchial smooth muscle contraction. B. Increased lung compliance. C. Decreased lung volume. D. Loss of elastic recoil. E. D. Decreased tidal volume. Answer and explanation. Correct answer. Loss of elastic recoil. Explanation: in patients with COPD, airway resistance is primarily increased due to the loss of elastic recoil in the lungs. This leads to airway collapse, especially during exhalation, causing prolonged expiration and the characteristic wheezing. The loss of elastic recoil results from the destruction of lung parenchyma in emphysema, which reduces the ability of the lungs to maintain airway patency, especially during expiration. Additionally, COPD leads to airway narrowing and increased mucus production, further contributing to increased airway resistance. The reduced FEV1-FVC ratio and increased residual volume in this patient reflect air trapping, which is also a consequence of the loss of elastic recoil. Why not the other choices? A. Bronchial smooth muscle contraction, bronchoconstriction, e.g. in asthma, can contribute to increased airway resistance, but in COPD, the primary issue is loss of elastic recoil rather than smooth muscle contraction. B. Increased lung compliance. In COPD, increased lung compliance is seen in emphysema due to the destruction of alveolar walls, but it does not directly increase airway resistance. In fact, it can make breathing easier in the early phase of the disease. C. Decreased lung volume. While lung volume may decrease in later stages of COPD due to air trapping, the increased airway resistance is primarily due to loss of elastic recoil and airway collapse, not decreased lung volume. E. Decreased tidal volume. Decreased tidal volume can occur with severe COPD, but it is a consequence of the disease, not a primary cause of increased airway resistance. Key learning points. COPD increases airway resistance due to loss of elastic recoil in the lungs, especially in emphysema. Airway collapse during exhalation leads to prolonged expiration and air trapping. Pulmonary function tests show a reduced FEV1-FVC ratio and increased residual volume in COPD. Treatment of COPD focuses on bronchodilators, corticosteroids, and oxygen therapy, which aim to reduce inflammation, improve airway patency, and relieve symptoms. Would you